By the time that you watch this movie, you will have already experienced at least one session of the ACUDETOX process and the ACUDESTRESS that goes with it. And I'd like to spend a little time with you making sure that you know the essentials of the beginning and of the whole program. Firstly, the whole program. I think it's very important that you realize that results occur after the 3 weeks of ACUDETOX, rarely during. And so during those 3 weeks, you can just sit and relax. And in fact, I very much want to encourage you to do that. In fact, I also would like to suggest that you don't make any other changes that are attempts at making this work any better, that you don't try any harder to be stress-free, that you don't take new medications during the 3 weeks or stop medications that you're taking. Just try and keep things the same, and that will give you a better perspective on the process. What you will notice when you have the pins in place is that you are much more relaxed. It is very rare for a person not to be relaxed with them in place, although in the beginning, especially the first 3 sessions, some people may find the insertion of the pins to be slightly painful. This pain doesn't last, as you probably already know, and it would also get less as the sessions progress. So what are the results? Well, the results are something that would be very hard for you to anticipate, because one way or the other, you have not done anything like this before. You've not done anything exactly like this before. If you've ever taken medication for stress, well, what you notice is that virtually as soon as you start taking the medication, something happens. But basically what happens there is that the negative side of your expression becomes limited. The medication tends to keep you within the narrower boundaries of only the positive side of the way that you have characteristically learned to deal with life. This may be a good thing if what has happened is something in the outside, some overwhelming event that you just need to regain your strength and pass through. But if the problem of dealing with stress is something more long-standing, something that you've inherited from the experience of your whole life, then medication is likely to disappoint you in a way by losing its effect as soon as you stop it. And usually, most of the time, people do want to stop medication after a period of time. The other experience that people bring to this is the experience they have of psychotherapy. And psychotherapy is very useful for helping you develop the positive side of your personality and increase your coping mechanisms in dealing with things in an ever more sophisticated way. But ACUDETOX, ACUDESTRESS does not work this way at all. It does not develop what is already there, but it supplies something new, or something that's been held in abeyance, or as I call it, something that's been on the shelf for the majority of your life. And we'll talk about this in terms of how you acquire this way of going about life that has its positive side, has its negative side. And we'll talk about how life tends to be about, of course, trying to stay on the positive side mostly and to try to avoid the negative side. Again, we won't be doing that here, because when you, at the end of the 3 weeks, think about the results that you get, you will have both the positive and the negative side still there, but you will have a resource that allows you to blend these in a way that really works in a different way for you. What else do you need to know? Well, you need to know that there basically are 3 phases The phase that is featured in this first week, and varies from person to person, is called the detoxification phase. And it basically does feel, you can probably sense it yourself when you have the pins in place, you feel like a certain stress is leaving you, especially at the time and for a period of time afterwards. So it is as if the stress is like a toxin within you that is draining away. This is very pleasant, and you should just appreciate it for what it is. There's nothing that you need to do with it, but watch it. But that's not the whole process here. The whole process gives way to two other phases. One is the middle phase or liminal phase, in which what happens is that we are not using our old mechanisms and not really having new mechanisms in place. So what happens is that we are betwixt and between. We feel a little bit discombobulated, and during this time we actually may have a little difficulty with the process because we kind of grasp onto our old mechanisms for dealing with things. And sometimes this results in conflict with others, where we try to bring our usual way of functioning into play. It doesn't work. We may even find this, because we are beginning to develop a kind of a distance from it, we may even find that we kind of are watching ourselves do this, observing, and that in the end we can decide just to drop it and laugh at it. That's what often happens. In the third phase, the integrated phase, we begin to have snippets of newness come to us, and this is kind of fun. We feel a kind of more lightness of being. We feel that kind of optimistic that something is about to happen, and it is. So what I'm suggesting to you now is that you simply sit back, relax, and enjoy the process, and we'll keep you abreast of what you need to know every step along the way.